This morning on the phone with me, I am so proud to have Dr. Kamran with me, and an international recognized pioneer in the field of phlebology and vascular surgery. Dr. Kamran, how are you this morning?
I'm fine. Thank you very much. And thanks for all the compliments.
You deserve every one of them. Come on now. Don't be too modest there, Dr. Cameron. Listen,
Thank you very much.
I've got some questions I wanted to run by you real quick because I've had some people asking questions about your practice and about vein disease. Now, does vein disease affect just older adults?
There's this misconception that it only affects elderly. It really starts, I think, at the very early age, probably maybe at 14 or 15. It doesn't really show his ugly head till maybe later on in life, but it starts very early on. So when patients have a lack of energy in their leg, they get night cramps, heaviness, tiredness. I've got hikers who tell me that, once we treated their veins, they can hike better, runners can run better. So just because you don't see the veins, they think they don't have the disease. And you could have it and not know that you have it even when you're young.
So not so affecting the young as well as the old. And I know that it seems women who are about to give birth see a lot of vascular system changes too, right?
Absolutely. I'm really glad you asked that question because if you have venous insufficiency is genetics. If your mom, dad, somebody else had it, you're probably going to get it. And you don't know you have it until you get pregnant, and then the hormonal changes affect those veins. So a lot of people during pregnancy, they find out, they get all these veins pop up, or the leg gets swollen, or maybe during the period their legs start aching. That means they have venous insufficiency. And I really think at some stage it should be part of your prenatal care because there is also one thing we don't talk about is if you have venous insufficiency, you can get clots.
Ooh.
So some people, during the pregnancy, you don't want to find out that you've got clots.
Right.
And in addition now, unfortunately, because of coronavirus, there's the risk of clotting is even increased. And a lot of people who are pregnant haven't had the corona shot because they're worried about it. So I think it's extremely important if you're a young lady and you're thinking about getting pregnant, I would at least have your veins checked to make sure you don't have venous insufficiency because that is not only the looks, it's not only the symptoms, but it also could potentially prevent you from getting clots.
Of course, they can get in touch with your office and get a free consultation also, right?
Absolutely. So essentially we do free consult unless, for some unknown reason, like people who work for the government, legally we cannot give them free consultation. So if they call, we can tell them if they qualify, and pretty much majority of people qualify for free consultation. And that's what we do. We just have a quick look, check the symptoms, signs, and they've got venous insufficiency. We tell them if you don't, great. You're on your way. You're going to be a lucky person not having venous insufficiency. You don't have to worry about it. Yes, we absolutely offer free consultation.
So one last question. I had a lady, she goes, I hear Dr. Kamran on the radio all the time, and she wanted to know the next time I talk to you, if I'd ask you this question, if spider veins are a sign of underlying disease, or is that just a cosmetic thing?
Spider veins, not always. But usually, if you have a spider veins, it's quite possible that you have some underlying venous disease. So what I do in my practice, I always, before I inject them, I do a quick checkup, make sure there is, look with an ultrasound, make sure they don't have any deeper issue bother them.
You're one person that is really into their job, and you love making people better. I know that for a fact, Dr. Kamran. That's just the way you operate.
Appreciate that.
And listen, if you think you're suffering from vein disease, by all means, call Scarlett's Vein Care. They're over in the Waterford Center in Leland. Brand new building, beautiful building. And you can get them at 910-726-3737. Dr. Kamran, thank you so much for talking to us this morning.
Thank you very much for calling on me.